we face, and of course for the crises that are yet to come. We all watched, as per the norm, media outlets predicted the African continent would be the first to suffer immense losses due to COVID. And while no death or life should be taken for granted, African nations were some of the most prepared in addressing and facing this crisis. It's in those lessons and those successes where we can search even more deeply for the solutions to our own and also global challenges. So, with that said, I thank you for your time, your attention, and your attendance today. And I thank you most importantly for the work that you've already accomplished in your respective areas of expertise. I truly look forward to today's discussions and to the collaborations that will develop from the relationships that we're building here today. So with that said, I'd like to thank you all, and I would like to turn it over to Julie Gichuru, the Chief Public Affairs and Communications Officer of the MasterCard Foundation. Thank you.
Thank you so much, Uzo. Good morning, everybody. How are we feeling? Thank you all so much for making time to be here with all of us. This is very exciting for the MasterCard Foundation. We had started our partnership with Africa CDC during the pandemic, and I'll go into that a little bit more, but just to co-host with the Africa CDC team led by Dr. Ahmed Ogwell, and with the Africa Center team led by Uzo. It's important that we're coming together in a space described as a home away from home to really talk about an important African agenda for health. So we're here because Africa, as you have heard, has embarked on a very bold journey. And it's an exciting journey. It means so much for the continent. Strong public health institutions, a skilled workforce, and at the foundation, we really are focused on dignified livelihoods for young people. Our mission is 30 million young Africans in dignified work by 2030, and we know health could be a huge driver of those opportunities. We want to look at capacity for manufacturing and so much more. And to get all this work done, we have to come together. No leader, no single institution can do this. We must partner. And over our period of working with the Africa CDC, as I said, we started during the pandemic in 2020. We worked together to get test kits across Africa, COVID-19 test kits, 2 million of those, and to equip, train, to skill, and to deploy 12,000 community healthcare workers. We then launched Saving Lives and Livelihoods last year, a $1.5 billion partnership to do 4 things to ensure that we purchased vaccines for over 65 million people, enabled vaccines of millions more across the continent, built human capital development around workforce for vaccine manufacturing on the continent, and strengthened the Africa CDC. And over this journey, we've learned that partnership is not easy. You have to grow into it. It takes candor, openness, constant feedback, willingness to collaborate. It takes trust. And we believe we've got to create that across all our different ecosystems to come together to really, really help push the new public health order for Africa forward. As I wind up, let me just say, thank you to all those who are in government here, public sector, in private sector here, different foundations and philanthropic partners. But let me also mention the media who have joined us today. Because sometimes we forget we're waiting for the media to tell the stories, right? But we forget they're a key partner on the journey with us to help us improve what we do and how we do it. So let me just thank you, Nozi, so much for just making time and coming here to guide these conversations. Larry Madowo, thank you so much for being with us as well. And Alan Kasuja, thank you for joining us. You are all partners on the journey. Asanteni sana. And Uzo, you are a storyteller as well. Beasts of no nation, so powerful. A reminder of the challenges that Africa faces, and a reminder that we must all do better for the continent. And with that, let me hand back to, please, to Nozifo. Thank you all so much for being here. Asanteni sana.
Ladies and gentlemen, we've just been reminded that partnerships are hard work, and they're going to require candor. They're going to require us to still keep listening even when we don't like what we're hearing. And that's the work that's been cut out for us. So a big thank you to Dr. Uzo, a big thank you to Julie as well. Now, those were our welcoming remarks, and now we're going to move on to a statement that forms the frame for our opening remarks. And so on behalf of Her Excellency, Dr. Monique Ntsabangwana, the Deputy Chairperson of the African Union, I'm going to call upon the Acting Director of Africa CDC, Dr. Ahmed Ogwal Omar, to kindly please deliver her remarks on her behalf. Can we give a big round of applause, please?
Thank you. Thank you, Nozi, for that kind introduction. And good morning for those of us on this side of the world. Good afternoon and good evening to those on the other side of the world. On behalf of the Africa Union Commission, and specifically Her Excellency, the Deputy Chairperson, Dr. Monique Ntsabangwana, I would like to deliver this message from the Commission. Honorable Ministers of Health from Ethiopia and Rwanda, Excellencies, ambassadors and members of the diplomatic community that are present here today, leaders, representatives of international organizations, partners, academia, invited guests, ladies and gentlemen. At the outset, allow me to express my gratitude to all of you who are present here at this very beautiful place, the Africa Center in the middle of Harlem. Now, these are my words, not hers. It's really, I feel a bit of shame that this is the first time that I'm coming to the Africa Center, despite the fact that I come to this city, not regularly, but I've been here quite often. So, Uzo, you have some work to do there to make sure that we not only know the place exists, but we hold as many events as possible on this side of town. So she welcomes all of us who are here, as well as those who are following up online through the live stream facility that has been set up by the organizers. As we see it, this place signifies how beautiful our continent of Africa actually is. Africa is the cradle of humanity, the source of life, and the basis of modern civilization. Our continent has prevailed through various challenges and has provided glittering hope for the future of humankind. That is why Africans may go out of Africa and reside somewhere else. Harlem is a good example, but Africa cannot get out of Africans' hearts and minds wherever it is that they may be. Distinguished guests, ladies and gentlemen, the ongoing COVID-19 pandemic has had serious challenges to the continent in the past 2.5 years. The Africa Centers for Disease Control and Prevention and the African Union Commission has, during this time, relentlessly worked day and night to reduce the impact of the pandemic by providing timely and effective leadership and responses on the continent and beyond. The African Union Commission has also propagated the new public health order to enable our member states on the continent to realize Agenda 2063, the Africa we want. And this includes seeing healthy and well-nutritioned citizens. Today's session will discuss the role of respectful and action-oriented partnerships in African public health. It is essential for us to consider this agenda and gradually develop its concept into action. This will require careful evaluation of the existing and previous models of partnerships on public health in Africa, and also develop clear concepts that we seek for future partnership models under the auspices of Africa's new public health order. The Africa Union Commission stands ready to partner with all of you to ensure that this new public health order not only succeeds in Africa, but the whole world. I would therefore like to take this opportunity to formally announce that this event is now officially opened. I thank you.
Dr. Uma, I'm going to ask you to stay on stage because we've got another job coming up for you in a couple of seconds. Thank you so much for obliging. Ladies and gentlemen, one of the things I think we're very well known for as Africans is that we're very generous with applause and ululation. Now, that round of applause was very, very timid. So can we just try again? Thank you very much. I do appreciate that. So, we're getting ready for one of our first conversations. I want to bring to your attention again, on your screen coming up is the Slido code one more time. And that, of course, is to also be very intentional about extending that invitation to our online audience to say, please use the Slido code so that we can get your voice into the conversations that are about to take place. We're going to start off with a conversation, a one-on-one interview between Dr. Ahmed and Larry Madau, who is, of course, international correspondent for CNN based in Nairobi. And the context of the conversation is looking at the Africa CDC and saying, what are the achievements to celebrate to date, and how do we also build on these to begin to contextualize the new public health order? So please can I ask a warm round of applause for my brother Larry as he comes up.
All right, so that applause was also timid. If we're keeping that energy, we just have to keep the same energy through the day. Some people can be getting warm applauses and others are getting timid applauses. I'm feeling some type of way about that. Thank you, so spontaneous, completely unprompted. Thank you. Thank you so much. Listen, how many of you have been hearing since we got here the new public health order for Africa and you have no idea what that is? Let's be honest, hands up. 2, 3, why are you here? I'm joking. Listen, it's just, they just started to talk about it. So you have come to the right place. Dr. Ogwell, thank you so much for being part of this conversation. And I want to start there. I have spent a lot of time in this pandemic talking about the problems we have on the continent and why exactly we had some people with too many vaccines and others with not enough, even when we had money for it. So let's be honest, people were selfish and a lot of people were left exposed in our part of the world. And so despite all the challenges, the Africa CDC, I think, came through in new, wonderful ways to make sure that vaccines were getting to the people that needed it all across the continent. You coordinated that in an incredible way. And so what do you think has been the biggest lesson from this pandemic for the African continent around public health?
Thanks, Larry, and good morning to those of us who are here, and good afternoon, good evening to those joining online. We've learned several lessons, and today I would like to share only 2. One is when we have a big public health event, a pandemic is a good example. Africa is on its own. And COVID is a good example. When we have a smaller one, which is not global in nature, it's yellow fever, cholera somewhere, monkeypox, Africa is still on its own. So the lesson we are learning is that whatever the situation, when it comes to public health emergencies, Africa is right at the back of the back queue. And this is a lesson that we must ensure we address going forward. Now, during this pandemic, it was very clear that African countries had some experience. In fact, with hindsight, we have a lot of experience when it comes to public health preparedness and response, because we see some of these diseases and outbreaks very regularly. They're small, we are on our own, so we fix them. But we have not been coordinated for quite a while as a continent, whether it is amongst countries, our regional economic blocs, or it is the partners who are working on the continent. Everyone is doing their own thing. And sometimes with relatively embarrassing results, and I think the Ebola crisis of West Africa is a good example, where billions were thrown in to the region, but the results came very slowly. So when the vision, and this is part of the lessons we've learned, that with the vision of our heads of states of setting up a public health agency for Africa, it was very clear that from the beginning of the pandemic that the presence of Africa CDC coordinating action on the continent made a huge difference. And that is why all those who are predicting death on the streets for Africa fortunately did not get to see their predictions come true. And the bad question they were asking is, so how come not so many Africans are dying? I think that's the wrong question. The right question is, what did Africa do right so that we did not get to see so much suffering, the burden of illness and death? So these are some of the lessons that we've learned during this pandemic, and we are looking forward to putting them into action so that the next outbreak and the next pandemic will not find us unprepared again.
Right. Some Western news agencies, I don't know which ones, but some Western news agencies that were predicting the death of Africans in droves and were embarrassed and disappointed that it didn't happen. And I think I have to say, I'm somebody who covers the facts as they are, and the existence and the work of the African Centers for Disease Control and Prevention did save lives on our continent. I think we can all agree on that. The work... I did not pause for applause, but it was well-fitting. That was the right point to applaud. So thank you. So what are the things that we did right? What are the things that you did right as an organization to make sure that that predicted huge amount of deaths, blood running down the streets of African cities did not happen? Because then I want to launch into the new public health order and why this is so important to make sure that we're future-proof in the continent from pandemics to come.
We did many things right, and one day I hope that we'll find the time to document this properly. And Julie, I challenged the MasterCard Foundation to ensure this happens. So the key things we did, let's start at the policy level. Our heads of state in 2020, under the chairship of His Excellency President Cyril Ramaphosa, he was the chair of the union at that time, took this as a personal project. And they met in excess of, I think, 14 times in 1 year. Virtually, but still they made time to sit and come listen to Africa CDC, give us guidance, and give us the resources that we needed and authority to be able to go back and respond. So that is one thing we did right. Our heads of state took the leadership that was required at a time when there was no leadership globally, leave alone on the continent. They took leadership. The second thing we did right is, as Africa CDC, we stuck to our call of using evidence to respond. Everything that we proposed, everything that we acted upon was based on evidence. Not the type of evidence that some news agencies were predicting, but the type of evidence that is real for the African continent. Third is the sheer solidarity of the public in Africa. when lockdowns came, as painful as it was, the public supported it largely. And we bore the pain and controlled the waves and after waves that came of the pandemic. Finally is partners. Partners came based on the priorities of the continent and supported us in a very effective way. And I must say that the way that we saw the partnership during this pandemic is very different from what we were seeing before. In public health, generally before, many partners would come with their agenda and then let you know that they're going to support you in a particular way. During this pandemic, we set the agenda and partners fitted in, and we've had a very broad coalition of partners. Up to now, we are probably above 120 different partners that we are working with on the continent, but all based on one plan and one coordination mechanism, effectively communicating and cooperating across the continent. These are the things that I would say we did right that have contributed in a very big way to the numbers remaining small, whether it is those infected or those, unfortunately, who are dying. We are documenting very well what we did right so that it can be able to help us in the next outbreak, and we hope that we can be able to put that to good use in the days to come.
At present, do we have enough vaccines on the continent for everybody that needs it?
No. And that may come as a surprise to many. The actual number of vaccines that we need are not enough. But we are not getting the vaccines we have out to the public fast enough. So it is, we need, and yet we are not consuming. And these two things are not contradictions, they fit in together. Now, the reason why we are not getting the vaccines out to the public as fast as we would want is because the vaccines came late. The time we needed vaccines in late 2020, up to middle of 2021, there were no vaccines. And as you are sharing earlier, we had the money. We knew the vaccines are being manufactured, but we could not be able to access them. That's a very big lesson, that money actually is good only when it can buy something. When we had $2 billion, but we couldn't buy any vaccines. So although we don't have enough vaccines to be able to cover the needs of the continent, we also are not consuming what we have fast enough, because there's a perception that maybe the pandemic is going away. Second is the mechanisms that we have at country level are not designed to vaccinate adults. They are designed to vaccinate children. And in this way, putting in place new mechanism to go out to the markets, to the places where the public are, requires a lot of resources. And these resources, African governments, most of them do not have them yet. So in this way, we don't have enough vaccines, but we also are not consuming what we have fast enough. And that's where this partnership of saving lives and livelihoods comes in, very important. We are doing mass vaccination campaigns across the continent, and we are seeing the difference by the consumption actually going up much faster than it was before the initiative.
So because of this tapering off in the number of people who are getting vaccinated across the continent, we have a bit more vaccines than we had a year ago today, but not as many people are going out to actually get the shots. When will we hit that target to vaccinate at least 70% of the population based on the targets that the entire world has and the World Health Organization has set and the Africa CDC has hoped for?
The global average today of vaccination is 60%. So the globe has also not reached that target. As Africa CDC on the continent, we had set for ourselves a target that by the end of this year, we should have hit 70%. The pace is not where it's supposed to be. We are ramping up, but we are still at about 22%. So we still have quite a significant journey to go in a few months. We are going to try our very best to reach there. And I must add here that there are two levels of immunization that we get, immunity that we get. Vaccines and natural immunity if you get infected. So now again, what we are doing is we are going to study in our population what's the level of natural immunity that we have, so that we recalibrate our targets in a way that is practical, so that when we go out to push for vaccination of up to 70%, we are doing it as from the beginning using evidence. This is very important for the continent so that we can be able to ensure that we are building systems that will serve COVID-19 vaccination and will also serve any other vaccination that we may need, monkeypox, yellow fever, or whatever else may come up in the months to come. But for targeting, we still are with 70%, and we'll work the best that we can to get as close as 70, if not to hit it.
All right, you opened with a profound realization from this pandemic that Africa is on its own. There's no cavalry coming, the others don't care about us, and we have to take care of ourselves as a continent. That's just the reality, right? And so we have to guarantee our health security to make sure that when the next pandemic happens, not if, but when it happens, we are ready. And that's why you're launching this new public health order for Africa. Give us a quick overview of what this means and how this is different from the mindset we've had, which has been Benin is looking for vaccines on their own, Djibouti, Togo, Ghana, Zambia, and sometimes that falls short.
Yeah, so even before the pandemic, when Africa CDC came into being, launched on 31st of January 2017, from the very early days of the institution being in place, it was very clear that African countries working on their own could not be able to meet the planning needs, the coordination needs of a multi-country outbreak. And so what individual countries could not be able to do on their own, Africa CDC came to be able to do at the continental level in a coordinated manner. Progressing, it was also clear that the way the health security architecture globally is designed, it was not very good for Africa because the resources were elsewhere, the information was elsewhere, the analysis and determination of whether there's something which is an outbreak was somewhere else, and then the response was being led by other institutions.
So Africa didn't have the agency to deal with our own healthcare challenges.
The agency was not there, but the expertise is there. So what we needed was a structure to bring together all the resources we needed, whether it was experts, it was health, public health infrastructure, or it was the strategies that are required to be able to respond. So it was clear we didn't have that. Then came our vision that if we are going to change the way the world views Africa, if we are going to change the way Africa responds to public health emergencies, we needed something new. And so came Africa's new public health order. Africa's new public health order has 5 pillars. The first is strengthen institutions. If you don't have an institution in place before an emergency, when the emergency comes, it doesn't matter how much resources you have, you will still struggle. And I think an example of this country is there. They had institutions, but it was not allowed to work as it's supposed to work. So strengthen institutions at the continental level. This includes Africa CDC, the Africa Medicines Agency, and others, and strengthened institutions at the national level, what we call national public health institutes. This is first pillar. The second pillar is strengthened workforce for public health. So every professional who contributes towards public health on the continent, we needed to ensure that we train them appropriately, we provide them with the tools that they need to be able to do their work, we deploy them in the right places. That means we needed to have enough numbers of all the cadres, not just within public health, but also outside of public health, including journalists for communication and community engagement. Third pillar is local manufacturing. I'm glad Minister Leah is here. I used to feel very sorry for her when we wake her up in the middle of the night so that we can go to the airport and receive masks and PPEs, really simple things that we should be able to do ourselves. But we did not have the manufacturing capacity, not the knowledge. The manufacturing capacity was not there on the continent.
Even for masks and...
At the time, we didn't have enough of them. We had few, but the vast majority were being imported from elsewhere. So that embarrassment should not happen again on the continent. We must manufacture what we need in quantities that make sense for the burden that we have for outbreaks and health emergencies on the continent.
There's an interesting point here. Africa only manufactures 1% of the vaccines we consume.
Yeah, and that 1% is generous in the sense that it does not include COVID-19 vaccines.
So before COVID-19, we were only
1%.
manufacturing 1%
Yes.
of the vaccines we need.
Yes.
After COVID, it's lower than that.
Much lower, because we did not at the beginning of the pandemic have any capacity to manufacture COVID-19 vaccines. Today, we have some capacity, but that capacity is for fill and finish. It is not for manufacturing from scratch to the end. So if we add the COVID vaccines that we need, the 1% becomes smaller. This is not acceptable for 1.3 billion people. So that's the third pillar, manufacturing on the continent, anything that we need within the health sector. Fourth pillar is domestic resources. And I don't mean money only. I mean mobilizing technical resource, mobilizing institutional resource, mobilizing money, so that the continent is able to respond whenever an outbreak actually occurs before we invite friends from outside of Africa to support. So mobilizing domestic resources is extremely, extremely valuable from both public sector and the private sector. The fifth pillar is what we are discussing here today, and that is partnerships. But partnerships that are action-oriented, delivering, and partnerships that are based on our priorities. If a partnership is not respectful of our priorities, it is not a good partnership.
Let's talk about those partnerships, because we saw a lot of countries make a big deal about donating vaccines to African countries that were expiring in 2 weeks. And we didn't have the capacity to store them. I mean, let's keep it 100, right? And so you saw countries like Nigeria destroying thousands and thousands of vaccines because they just didn't have the capacity to put them in people's arms quickly, or they were close to expiring.
Let me say...
He can't talk politics, but I can. So that's why he's...
Let me remain diplomatic.
And eyeing.
Yes, and say two things to this. Any help that you get that is timely is good help. Any help that you get and gives you a burden is bad help. In fact, we should not be able to call it help at all. Vaccines are time limited, like many health products. If you're given a vaccine that is not going to last the time you need to get it into people's arms, that is not help, it is a burden. So in this way, as Africa, we are very careful. And as Africa CDC, we've provided our advice to governments: don't take any help that you cannot be able to use. That is why for our partnership, they must be action-oriented, delivering something, and respectful of priorities. And I tell you, short expiry, anything is not a priority for the continent, because then it gives us the burden of destroying those products because we are not able to get them into arms fast enough.
We have a couple of ministers of health here. We have people who make policy and look after public health infrastructure in different countries. Obviously, one of the big challenges that we saw really laid bare in this pandemic is just the weakness of public health institutions across the continent, the lack of capacity, the lack of resources, the lack of training, all of that. What is the role of these ministers and public officials in making sure that we are also ready for that next pandemic, and we're strengthening these institutions and this the public infrastructure to be prepared for when we're hit again?
I mean, at country level is where we succeed or fail. So when we have a good vision like the new public health order continentally, which, by the way, many other regions are already picking up and implementing portions of in their own way, our ministers, particularly those of health, but also from other sectors, then cascade that to the national level. They adapt based on their local circumstances, and then they guide and lead the process of implementing the new public health order at the country level. And our ministers of health, not because they are here, have been fantastic, and they have led the implementation at country level of what our heads of states are deciding at the continental level, and that's why you see the success that Africa CDC has achieved over the last 2.5 years.
All right, I want to take some of these Slido questions. One is from Claudia, who asks, when we started the Africa CDC discussions in 2016, 2017, there was a pushback from powerful global health structures. Would you say where we are, we proved them wrong?
Yes. And we will continue to prove wrong anybody that has the perception that Africa cannot be able to do this. In the words of President Kagame, what we have learned tells us that we need to do these things on our own, but it doesn't mean we should do it alone. So those who are our friends will come with positive energy and we'll work together. Those who are not our friends, we will leave them behind.
All right, well said. Another question, this is from Tura Galgalo in Kenya. What plans does the Africa CDC have to harness information sharing, especially surveillance data across member states?
We are doing two things. One is strengthening the national public health institutes. And by doing that, it means that data collection at country level is efficient and actually happening. Because you can't talk of data sharing if you're not collecting any data. So this is one thing. Second is we are working with all the countries to establish data sharing agreements so that Africa CDC becomes the interface between all the countries. That way, when the data comes, we are able to see if there is a pattern across the continent. And if there is anything beyond one country, we can also be able to see that by getting data from different countries. If we don't have good data sharing mechanisms, then we cannot be able to have an early warning system. And that means that we'll be able to be caught out when the next multi-country outbreak comes. So this is one of the key priorities of Africa CDC, to ensure that we are getting data in a timely manner, we analyze it in a timely manner, and we share back with the member states what we are seeing across the continent. So far, the progress is good. We are very happy with what our member states are contributing, and it can only get stronger when Africa CDC also gets stronger.
Let's talk about the money, because I don't think we have discussed that yet. The new public health order.
They are lenses. So it is our responsibility to give them the reality of Africa, to show them where their support can be helpful, for not only Africa, but also the global health security architecture. But domestic resourcing. We have resources on the continent that we need to put in the right place. Abuja Declaration, 15% into the health sector. We need to reach there. And then within the health sector, whatever has been allocated needs to appropriately be secured for health emergencies. This is something that has to be done at country level, and we are working with our ministries of health to see that health security agenda is being given the rightful prioritization in terms of resource allocation that it actually does deserve. We don't have enough, but we do have some to be able to begin work with.
Dr. Ogwell, you talked a little earlier about how we're likely to miss the target to vaccinate 70% of our populations by the end of the year because we don't have enough vaccines and not enough people are getting vaccinated. There's a question here on Slido about changing perceptions and how do we accelerate uptake, because there's lots of apathy by most people because they think, listen, I've been alive for 2 years without a vaccine, so why do I need it?
This is the engagement that we need to have with members of the public. The fact that a car has not hit you until today is no guarantee that if you walk out today and you're careless, the car will not hit you. We need to be careful. And the best way to be careful for vaccine-amenable diseases is to get vaccinated. We don't know how your body will react when the next infection hits you. So the pragmatic thing to do is to be careful and to play it safe. This is the engagement we need with members of the public. The reality is when you take a long time to act, then it is less likely that you're going to get many takers in the beginning. But as we engage with members of the public more, we share the right information, we debunk all the interesting theories that are out there, the more that we see the uptake is coming. In fact, under Saving Lives and Livelihoods initiative, when we are doing mass vaccination and actually getting information and the vaccines available to members of the public, they are taking it up. So it is not that they don't want, it is just that it was not convenient for them to leave their activities, economic activities, to go to a health facility which is far, and then they queue for long periods to be able to get the vaccine. If you get it to them, they will take it. And that's what we are doing at Africa CDC.
Okay, let me take this one final question about the other public health body that operates on the continent. What is the relationship between the Africa CDC and the World Health Organization Africa Division? Where does WHO's responsibility for Africa end and the SCDC's begin?
Correction. Africa is served by 2 regional offices of the WHO. One, the regional office for Africa based in Brazzaville, and another one, the Eastern Mediterranean Regional Office, which is based in Cairo. So Africa is 55 member states, and WHO 2 regions are serving it. We serve the whole continent. Our relationship is one of synergy. The UN system, and not just WHO, there are others. There is UNICEF, there is UNFPA, there is WFP. There are institutions of the UN that have been operating in Africa for a long time. And when our heads of state established Africa, it was to coordinate the whole continent in the context of the Africa Union. We are all working within the public health space. And let me tell you, even if there were 10 Africa CDCs with the kind of burden that we have now, and the minimum resources that we have, it will still not be able to cover. We must work in synergy, and we are working very closely with the WHO and other UN agencies in ensuring that the resources that each organization has is reaching the right place and making a difference on the continent. And I dare say that with the presence of Africa CDC, many players on this continent have styled up, and they are doing better work.
Well done. Okay, what?
That data that is being collected all the way from the community up to the pinnacle of decision making is digitized for speed, reliability, and therefore you can save the data in a very good way for future use. It's not an option. We must digitize if we want to be able to respond faster than we are doing now.
Okay, so in the final 30 seconds of this, I want to give you the final word on the new public health order for Africa and why this is such a critical part of making sure that we future-proof ourselves from the next pandemic. What do you want the people here to take away with them?
Africa has to start doing things on their own. And the only way to do that is to have homemade solutions that are based on homemade